Hello, this is Dr. Praveen Ramachandra. I'm senior endocrinologist working in Diaplus Endocrinology Clinic, Yelahanka, Bangalore, India. Please watch this video.
Okay, let's just dive right into this explainer. Chances are you, or maybe someone you love, just got a medical scan back and there's this confusing, honestly, kind of scary term staring back at you from the page, a renal cyst. Well, take a deep breath. Today, we're going to completely demystify this condition. This patient education explainer is actually curated by Dr. Praveen Ramachandra, a senior endocrinologist over at the Diaplus Endocrinology Clinic in Yelahanka, Bangalore, India. So we are in great hands. Together, we're going to figure out exactly what a simple renal cyst is, and honestly, more importantly, what it definitely isn't. We're starting right at that exact moment of panic, the accidental discovery. I mean, picture this, right? You go to the doctor for, say, a little mild stomach pain, or maybe just a totally routine ultrasound. Then a few days later, buried deep in that imaging report is the phrase, renal cyst. Boom. Instantly, your mind starts racing. Wait, is it cancer? Am I going to need surgery? Let's clear the air right now and show you exactly why this bit of medical jargon absolutely shouldn't ruin your day. To take the anxiety out of all this, here is our quick roadmap for today. We'll cover the accidental medical discovery, officially define what simple renal cysts are, and look at diagnosis along with something called the Bosniak scale. After that, we'll quickly go over some rare symptoms, talk about when treatment is actually necessary, and finally wrap up with your long-term outlook and general kidney care.
All right, Section 1, the accidental medical discovery. So the medical community actually has this kind of fun, informal term for these accidental discoveries. They call them incidentalomas. And the stat you're looking at right now, this is exactly why you can let out a huge sigh of relief. Up to 50%, literally half, of all people over the age of 50 have at least one kidney cyst. Half of us. It's actually even more common in men. So if you've just found out you have one, you are in a very large, very normal club. It's largely considered just a totally normal part of getting older. Honestly, kind of like getting gray hair.
Moving right along, Section 2, defining simple renal cysts. Okay, so what exactly is this thing? Well, a simple renal cyst is an acquired, completely benign, meaning absolutely non-cancerous, round pouch. The best way to picture it, think of it like a tiny little water balloon with a super thin wall that just forms on the surface of your kidney. Inside, it's just clear, water-like fluid. Now, it is absolutely crucial to know that this is totally different from inherited conditions like polycystic kidney disease, which is a much more serious genetic thing. A simple cyst, it's just an isolated little event. Your kidney just keeps humming right along, doing its normal job, filtering your blood, completely unbothered by this little water balloon. Okay, Section 3, diagnosis and the Bosniak scale. Now, how do doctors know for sure that your cyst is the harmless, simple kind? Well, they use some highly accurate imaging tools. The most common go-to is just a standard ultrasound, because a simple cyst is basically just fluid in a thin little wrapper. Sound waves from the ultrasound bounce off it in a very specific, recognizable way. Now, if that ultrasound isn't 100% clear, no big deal, they might order a CT scan or an MRI just to perfectly differentiate between a fluid-filled sac and a solid mass. Alongside those scans, they'll usually run some basic blood and urine tests just to double-check your overall kidney function and make sure there's no hidden infection. And that brings us to this really interesting tool, the Bosniak scale. This is the official grading system that radiologists use. So if your doctor says you have a simple cyst, what they are technically saying is that it's a Bosniak Class 1. And notice this right here, Class 1 cysts have a nearly 0% cancer risk. Zero. They require absolutely no medical follow-up whatsoever. On the flip side, Classes 2 through 4 represent complex cysts. Those have thicker walls or solid parts, and those might require some monitoring. But hey, if you're sitting in Class 1, you are totally in the clear. Next up, Section 4, rare symptoms and complications. So, like we said, the vast majority of these cysts just stay small and entirely silent. But, occasionally, one of them runs out of real estate. It might grow enough to press on other organs or stretch the outer capsule of the kidney itself. If that happens, you might feel this dull, nagging ache in your back, your side, or your upper abdomen. If it somehow gets infected, you might spike a fever. You could even see blood in your urine or find yourself needing to urinate way more frequently. Obviously, if you're experiencing any of these things, that is your immediate cue to go ahead and contact your healthcare provider. And just to be super thorough, in very, very rare cases, complications can pop up. A cyst could become severely infected or even burst, which, as you can imagine, causes sudden, severe back pain and blood in the urine. Or it could grow in a weird spot and physically block your urine flow, leading to some kidney swelling. I know that sounds super frightening. But the absolute most important takeaway here is that even these extremely rare complications are highly treatable by your medical team. All right, Section 5, Treatment, when it's necessary. Listen, for about 99% of simple cysts out there, the ones that are just small and silent, the official medical treatment is literally doing absolutely nothing. Just leave it be. But for those rare cases where intervention is actually needed, doctors have two main fixes. Sclerotherapy is a really quick outpatient procedure. They use an ultrasound to guide a tiny needle, drain the fluid out, and then inject a little alcohol to scar the inside so it can't just refill later. If the cyst is a bit more stubborn, they might opt for laparoscopic surgery. For that, the surgeon makes tiny cuts, drains the cyst, and actually removes the walls entirely. That one usually requires a short, maybe 1 to 2 day hospital stay. But both of these, they solve the problem permanently.
Finally, let's wrap up with Section 6, Outlook and Kidney Care. Here is the honest truth. You can't really prevent a simple kidney cyst from forming in the first place. Like we said, it's largely just a totally normal part of aging. But what you can do is dramatically reduce your overall risk for broader kidney issues. Make sure you're drinking plenty of water every single day. Seriously, hydrate. Try to cut back on excess sodium in your diet. And this is absolutely crucial. If you happen to have diabetes or high blood pressure, you need to manage those relentlessly. At the end of the day, those two conditions are the real enemies of your long-term kidney health, not your harmless little simple cyst.
Now, as part of his patient education curriculum, Dr. Ramachandra highly recommends taking a quick screenshot of this list right here. The next time you are sitting there in the doctor's office, pull this out and ask these exact questions. Ask them, how big is it? Ask if your kidney function blood tests came back totally normal. Confirm if you actually need any follow-up imaging based on your specific Bosniak classification. Having a list like this ready just ensures you walk out of that office feeling totally empowered and fully informed.
I really want to highlight this quote directly from the medical literature because it perfectly reiterates our absolute main takeaway for today. Just read that first sentence again with me. The outlook is excellent. Boom. A simple renal cyst is a completely harmless hallmark of an aging body. It is not some terrifying disease that you need to gear up to fight. So, let's end on this thought. That accidental discovery on your medical chart? Yeah, it probably gave you a pretty good scare initially. But now that you know you're safe, how are you going to use this moment? You know, sometimes a false alarm is exactly the wake-up call we need. So how will you use this moment today to drink a little more water, eat a little better, and protect your absolutely amazing body going forward? Think about it. Thanks so much for learning with us today. Keep taking great care of yourself, and we'll catch you in the next explainer.